Hi, everyone. My name's Whitney Gregory. I'm a registered nurse with Congregate Connect, and today I'm going to be going over ileostomy care and UTI prevention for one of our clients. I'm not going to say any names because that would be potentially a privacy violation, so we're just going to refer to her as our client, and I hope you learned something new today. So the first thing I want to talk about is just understanding what an ileostomy is. You may have heard of patients with colostomy bags. This is a little bit different because it's going through the small intestine. It's kind of the same thing, but a couple of things to watch out for with ileostomies. They are a little bit different. So it's a surgically created opening in the small intestine, also called the ileum, through the abdominal wall. It allows stool to exit into an external pouch, bypassing the colon. The reason for our client having an ileostomy is because she had what's called a neurogenic bowel. This is a nerve conduction problem that basically disrupts the signal between the brain and the bowel. So that signal wasn't working properly, and therefore she needed to get the ileostomy. What to expect? Your stoma, this is called the stoma. The stoma is the part of the bowel that's showing on the outside of the abdominal wall. It should look just like this picture. It should be bright red, moist, and raised above the skin. If there's any other color than this, you want to notify someone immediately. If it's white, if it's purple, if it's black, any color change going in those directions, you need to notify someone immediately because that could tell you that there's some compromised blood flow there. Um, the output is also slightly different in an ileostomy versus somebody with a colostomy. An ileostomy client is going to have very liquidy stools, and that's because the job of the large intestine, which is bypassed in this case, is to kind of pull the water out of the stool and reabsorb it into your body. Now, when you bypass the colon, you're not getting that. That process is completely eliminated. So therefore, the stools are going to be very liquidy, and you're also at an increased risk for dehydration, which I'm going to go over a little bit later in this presentation. So don't worry when you see diarrhea like stools. That's actually normal for this client. Daily ileostomy care. You're going to make sure to empty the pouch when it's 1/3 to 1/2 full. That's going to prevent leakage. If the pouch is too full, it's going to be heavy and it's going to pull on the seal, causing leakage. So be very, very cautious to be changing that pouch. It should be at least changed probably 6 times a day. Um, One tip I wanted to share with you that I thought was actually very brilliant, that another client had told me, was that if you place toilet paper into the toilet prior to emptying the pouch, you won't get any splashes. Now, because the stool is more liquidy, you are going to have more splashing. And so this could be a really great way to help prevent that splashing and just make your job a little bit easier. You're going to clean the skin gently with warm water only. Please don't use any soaps, lotions, wipes, anything that's not approved for use with the ileostomy. You're going to also check anytime you look at the stoma, check for redness, irritation, leakage, any of those things, and report those things if you do see them. These are all of your ileostomy supplies that come in a little plastic bag that's been prepared by the client's parent, which is really, really nice and convenient. And I love how everything is so organized for you guys. In this little kit, you're going to have your gloves, your mask, a skin protectant wipe, adhesive remover wipe for the old adhesive to kind of help get that off if you're, changing the whole pouch system, your barrier ring, your wafer, and the pouch. So let's go through the process, kind of start to finish on how that goes. The first thing you want to do is start with clean, dry skin. So when you remove the old pouch, you're just going to wipe around the stoma with a warm, warm washcloth and just kind of clean around very gently. Just make sure that you're not using, like I said, any baby wipes, body wash, oils, lotions, any kind of soaps, stuff like that. Only what's approved for use with an ileostomy. Um, the best time, typically, the best time, if you can, to change these pouches is first thing in the morning because the bowel is not as active at that time. So it makes your job a little bit easier if you change them in the morning. Sometimes you don't have a choice. Sometimes maybe there's a leak and you just have to do it middle of the day or end of the day, and that's fine. But if there's no leak and you can do it in the first thing in the morning before she's had anything to eat or drink, that is the best time. Um, after after you clean the skin, you're going to use a skin barrier wipe. That's that skin protectant wipe. Um, you're just going to wipe around the stoma. If there's any redness, irritation, any kind of bumps, rashiness, you can also use stoma powder. It's very important that you only use stoma powder, not baby powder. So this has to be stoma powder. This is a picture of what this one looks like from the Adapt company. Sorry, it's a Hollister. It's from Hollister. It's called the Adapt Stoma Powder. And that's a really good one. I'm not sure if our client has stoma powder or not. I don't think she's used it, but if she is to get any kind of rash or anything, you can use it and that'll help the bag to stick better. So you use the wipe. If there's any irritation, you can use some powder. You dust off the excess powder, and then you can place your barrier ring. I included a little step-by-step on the barrier ring up here. It's a very flexible putty-like consistency, and you kind of just shape it to the shape of the stoma. You don't want anything too tight around the stoma. You want it to kind of fit snugly, but not tight. Anything that's too tight around the stoma can compromise blood flow, which is really dangerous. So make sure that it fits snug, but like I said, not tight. Once the barrier ring's in place, you can unstick the sticky backing from the ostomy wafer, and you can place that right on top of the stoma and barrier ring. Once that's firmly in place, and the other thing you can do is kind of really hold with your hand around the sticky part, and that will help it to stay. You just kind of leave your hands there for a few seconds, 10 seconds, something like that, to help it adhere nicely to the skin. After it's adhered, you can then attach the pouch. I just want to talk about a technique called crusting. Now, this is if there's a little bit more significant skin irritation and you want to create a nice layer between the adhesive and the skin. And the process for this is nicely outlined in this video here. So if you want to watch that, feel free. Basically, you just put the skin protectant wipe, and then the stoma powder, dust off the excess, and then you repeat that process 2 or even 3 times to form a nice little crust around the stoma that you can then use to attach the adhesive to. When to notify the provider or the client's parent. If you notice any stoma bleeding or changes in color, anything that looks out of the ordinary, you're going to notify someone. If you see that there's no output for more than 6 hours, that could be extremely dangerous. It could mean that there's a bowel obstruction, which is an emergency. So make sure you notify somebody immediately of that. If you see any signs of dehydration, remember how I said the colon actually helps reabsorb water into the body. If you notice any signs like dry mouth, dizziness, even a change in mental status, she's acting, different from what her baseline is, anything like that, notify someone immediately. If the pouch is leaking or there's odor, that means there is a leak. If there's any skin irritation that's getting worse or it hasn't documented yet, notify someone. I wanted to go over what a neurogenic bladder is because the reason our client had the ileostomy performed was because of a neurogenic bowel. Well, the same reason she had the neurogenic bowel, she has a neurogenic bladder as well. That is a same thing, disruption between the brain and the bladder. So this can cause things like urine retention and frequent UTIs. Some of the symptoms of UTIs are cloudy, foul-smelling urine, fever, confusion, or irritability. If you notice any of these things, please notify someone right away. She may need to be checked for a UTI. How to prevent UTIs. Some of the things that we've come up with for our client in order to help prevent them or at least get less UTIs, encouraging voiding every 2 hours while awake, maintaining hydration status. This is going to mean that she's drinking 6 to 8 cups of fluid every day, providing perineal care from front to back after each void, avoiding tight clothing or scented soaps, using pH balancing soaps might help, and using probiotics may help. I believe our client is already using probiotics, so she can, continue to take those. That's already been approved by her physician. The last thing I wanted to show you are just a couple of helpful resources. Here's an ostomy bag change from start to finish. It's a pretty thorough video, so I really liked that one. And I also put a video of perineal care on a female client for you to just brush up on your skills. And the last thing that I'll say is if anyone has questions, I am available. I'm going to make sure that everyone has my information. And if they have any questions whatsoever, please reach out to me and I would love to assist you.